Good afternoon, students. So, I realize that some of the topics in your first chapter have been left out for medical sociology. So, let's finish those topics. The one important thing is lay concepts of health and illness. Okay, what is lay concept? Lay concept means you are a health professional. That means you are a person who is going to work in the health field. You are a medical person. There are people who are non-medical. They are called as lay people. Okay, for example, if your parents, if your grandparents, if your brother or sister are not in the medical field, they can be considered to be lay people. Similarly, in our community around us, in our villages and towns, there are so many people who do not know about the medical profession. They are called lay people. One simple example: when one doctor in Chennai died because of coronavirus, the people living in that area, they tried to prevent him from being buried, okay, in that area. So that is because of their lay perception, or because they were not medical professionals, they did not understand that a dead person cannot transmit coronavirus. So that is lay concept. So people who are not in the medical field, their perception of health and illness is called as lay concepts of health and illness. Hope you understood that aspect of it. Okay, in first year you would have studied about folk concepts. What is folk? Folk means in the village and town what ideas people have. Okay, so regarding health and illness also, people in the villages and towns, they have different ideas. Your parents would have told so many times, don't go out in the rain, you will get cold. Does rain and cold have a correlation? Have you ever thought about it? It may have, it may not have. The folk concept sometimes has some truth in it. But at the same time, the medical professional will say, even if you go in the rain, you will not get a cold, because cold is caused by either a virus or bacteria. So that is the difference between a lay concept of health and illness and a medical concept of health and illness. Okay, so medical concept is usually the medical model of health, and lay concept of health and illness can be considered to be the theory of people who are not in the medical profession. Okay, and let's see what lay concept about cause of diseases. Usually the lay concept is about the cause of disease. There are also lay concepts about treatment of disease, severity of disease. We will see that later. Okay, so what does this mean? This means that a person who is not in the medical professional, what they think about the cause of disease. Okay, which disease? Any disease. It could be leprosy, it could be diabetes, it could be cancer, it could be coronavirus. Okay, so we'll see what lay people think about leprosy. What do lay people think about leprosy? They think it is a curse of God. They think it is your sins which made you get leprosy. Okay, so that is lay concept about leprosy. So what do people think about coronavirus? What do lay people think about coronavirus? They think it is a disease which you need to stigmatize, where even dead people can transmit the disease. Medical professionals will tell you dead people cannot sneeze, they cannot breathe, so the virus will not come out through their oral system or the nasal system. Through their nose or mouth, virus will not come out. So that is the medical concept of coronavirus. But the lay people, those who do not know about the disease, what they'll say, even a dead person can transmit the disease. So this is the difference in which lay people and medical people think about cause of disease. Okay, so even the body functions, in the western countries, in US, people think a body is like a machine. So that is why they give a lot of emphasis on walking, running, to keep the body fit. It is like a machine, or your bike or car, where you have to do oiling, you have to do check the engine oil, you have to keep the engine clean, so that the machine will work properly. So that is the western concept of body. Whereas Ayurveda and the Indian concept and Asian concept of body is mainly the mind and the social aspect. and the physical aspect. So that is why in India, China, and other forms of medicine, the emphasis or the importance is given to mainly about the mind or meditation and things like that. Indian concept is do meditation, do yoga, and that will help your body and mind to be in union with each other. Whereas Western people say more running, more jogging, keep your body fit. So that is the difference between India and Western countries. And even about chest pain, in Western medicine or in English medicine or the allopathic medicine, okay, in hospitals, what do we say? Chest pain means immediately rush to the cardiac hospital or the chest pain unit, you rush. Okay, whereas Ayurveda tells chest pain is a symptom which is caused by emotionally upset people. So if you are upset, if you are sad, then you will have chest pain. That is Ayurveda concept. Okay, so you understand the difference between a lay concept of cause of disease and the medical concept of cause of disease. Another example is if some woman has a lump or a swelling in the breast, then the medical person will say it is most likely to be cancer, but a non-health professional would say it is most likely because of injury. Okay, so that is another difference between lay people and medical people relating to the cause of the disease. Okay, the next aspect is the severity of illness, treatment, and meaning of illness. Okay, what do lay people think about the severity of illness? What do they think about the treatment or the meaning of an illness? I already told you about the fact that leprosy, lay people think about leprosy as a curse of God. And what is the treatment according to them? They will say you go and do puja and wash away all your sins, and then you will be able to get rid of leprosy. But the medical person will say you have to take multi-drug therapy, which is a treatment for leprosy. Okay, similarly, what about poor people? What do they think of illness? A poor person who is having a poor socio-economic strata, they will think that unless you have no strength to work, then you do not need to go to a hospital. So that is what they say. If your disease is so severe that you are not able to work, then you have to go to the hospital. Till you have enough energy to work, they will not take care of their health. That is why we see a lot of patients in our hospitals in India who come very late for treatment when the disease is very severe. So they do not come to prevent the disease, or they do not come early to diagnose the disease very early so that they are cured. They come very late for treatment because they think till you are able to work, you should be able to get rid of the disease. Okay, so that is the lay concept about severity of illness. So only when you are having a disease very severe, then only you need to go to the hospital. So let's see where this lay concepts arise from. Okay, how do these lay concepts of illness and disease come? So if an individual tells something about a disease, then the community believes that, and then it becomes a concept. Okay, so for example, first if you think for example, a religious person, it may be of any religion, the religious person who is the head of the religious organization, if that person tells that the disease is caused by God, then everybody in that religion, or at least most people in that religion, will believe that the disease is caused by God. They will not think that the disease is caused by a virus or bacteria. So that is how lay concepts arise, because of individuals or single person. From that person it spreads to the society, and then everybody starts believing that a particular disease is caused by God or Satan or a devil or evil spirit, and they do not think that it is caused by a bacteria or virus. They do not understand the medical concept. Okay, so in rural India, rural means village, there are a lot of these supernatural thoughts. A lot of people think if you have problems in your family, that is because of evil eye. Okay, evil eye means கெட்ட கண் or அடுத்தவங்க கண்ணு போட்டாங்க அதனால தான் இப்படி ஆயிடுச்சு. ஸோ திஸ் கைண்ட் ஆஃப் கான்செப்ட் இஸ் present in our village and community. Okay, and similarly, as I said already, it is these concepts also arise due to the natural world. So if you are exposed to hot or cold climate or get wet in the rain, then people say you will get disease, you will get cold, you will get fever. But actually the medical aspect is, if you do get wet in the rain, you will not get disease. Only when the bacteria or virus cause the disease, you will get the disease. Okay, so that is the difference between lay concepts about the disease and illness. And this is how it arises. It arises from a single person, especially the head of the family or an influential person in the community or a religious person. So they tell some things about the disease, and soon slowly it becomes a accepted thing in the community, and that is how folk illnesses arise. Okay, that is how when large number of people believe in something, then that is called as a folk illness. Okay, it is a cultural thing. So when many people agree in a society, when lot of people agree to some symptoms, okay, and they say this is caused by this particular incident, then it is called as folk illness. Okay, I hope you understood. Folk illness means signs and symptoms in which are caused in a person with disease, which the community thinks is caused by supernatural powers. Okay, when hundreds of people believe in the same thing, then it becomes a folk illness. Okay, we'll see examples, then you will understand little better. Example of folk illnesses in India. Okay, so what are the examples of folk illnesses in India? The first folk illness is Sood in Tamil Nadu. It's a example which you see in Tamil Nadu or South India. It occurs both in males and females. We feel that when you urinate, you feel a burning sensation when you try to urinate. Okay, so when this happens, what do the people say? The people say it is because of Sood. And what do? They give you fenugreek seeds or vendayam, which is soaked in the water, and it is given to you. Or sometimes you are given massage on your stomach using castor oil, and you are told to take bath. Okay, but actually this symptom is caused because of lack of drinking water or dehydration. Usually it happens in summer or when you do not drink water for a long time and you are sweating. So there is a medical cause, but people do not believe in the medical cause. They say it is Sood, which is caused by heat, and they give cultural treatment for it, and that is one of the folk illnesses in India, and it is an example. The next folk illness is mass hysteria. Okay, mass hysteria happens when, for example, we heard a few years back, here we are not putting down any religion, but it is one example that we are giving, where people went to Ganesha or the idol of Ganesha. Okay, and they found that when they kept milk under his trunk, the milk got absorbed. So it spread in 2006. For nearly 1 week, all over India, people were rushing to temples to offer milk to the idol. But finally they realized that it is because of the clay which is absorbing the milk, and not because of the god drinking the milk. Okay, similarly, some people are killed in India because they think they are witches or evil spirits. And even people with coronavirus are locked in the houses, and people do not allow them to come out because of this mass hysteria. Then the next thing about folk illnesses is the possession syndrome. Another example, here we see that a lot of movies also tell that suddenly one person who is in a temple, they start shaking, shivering, falling to the ground, and they are seem to be possessed by either a evil spirit or possessed by God. And they tell in a different voice, in a different manner, they tell so many things about other people. So அது பேர் வந்து ஆவி பிடிச்சிருச்சு அப்படின்னு சொல்லுவாங்க சிலர், இல்லைன்னா சாமி இறங்கிடுச்சு அப்படின்னு சிலர் சொல்லுவாங்க. ஸோ this is called as possession syndrome. Okay, this happens especially during religious meetings. It happens both in Christians, it happens in Hinduism, it happens in Muslims and other religions also. This is called as possession syndrome. So this is all about folk illnesses. Hope you understood about folk illnesses, how it is caused, who creates these folk lay concepts of folk illnesses and examples of folk illnesses. Okay, next, the final topic in this chapter is origin of medical sociology and also about the health system in India and the Western countries. Okay, we have already studied about origin of medical sociology. Parsons is the founding father of medical sociology, but the field of medical sociology developed in the 1960s, mainly in the 1960s. And a few years ago also medical sociology was not well known, but slowly and steadily the growth of this field has seen tremendously. Initially medical sociology people were in the medical colleges only, but now they are in various professions. Medical sociology has another name also. It is called sociology of health and illness. Okay, the difference is medical sociology actually means sociology of medicine. So to change it, because there is we do not want medical professionals to actually be part of this profession, it is also called as sociology of health and illness, so that it is a separate field in itself. Okay, so it doesn't matter whether we call it medical sociology or sociology of health and illness. What we study is the cause of disease and how this disease can be prevented and cured. So the main aspects that we deal with is the health, emotions and health risk. Okay, so health means good health without illness. How do we promote health? Does exercises promote health? Does good nutrition promote health? Or prevention of diseases promote health? So what is health? WHO says health is the absence of disease or illness. So health promotion, and then how emotions can be controlled and how health risk can be controlled. So all this is under the field of medical sociology. At the same time, medical sociology professionals have also gone into other fields or interdisciplinary fields. Interdisciplinary means both the things exist together. So mainly criminology. Criminology means why do people commit crimes, and how can dealing with society and people prevent crimes. So that is one field. The other field is social science of science and technology. These days we see that science and technology is developing very rapidly. So we have to see how social sciences help in promoting this science and technology, how people accept. 20 years back when computers came into the world for the first time, all the banks and all the hospitals started getting computers, but the people did not know how to use it. Okay, but now all of you know how to use a computer, but now newer technology is coming, newer apps are coming, so the older people will not know how to use it. So that is the difference, and how this affects the health, how this affects the causes diseases, all this has to be studied. Okay, for example, even using the mouse of the computer for a long time with your hand can cause nerve problems. Or if you bend down and look at the computer for a long time, you can get neck pain. So you know how science and technology causes disease, and the same way using science and technology you can also prevent disease. Recently for coronavirus, the government has given an app called Arogya Setu app. So if you download it, and you will know how to prevent the coronavirus from getting to you by sharing your location through the app. So that is how science and technology helps in prevention and treatment of disease. Okay, the next important thing is the health care and health policy. Medical sociology professionals now have a major role to play in the health care and health policy. Okay, who makes the health policy? The government makes the health policy. So how does the government make health policy? Based on the advice given by experts. If you are a medical professional, a medical sociologist who knows about the public health, and if you are an expert in the field and if you advise the government, they will formulate health policy based on it. Okay, the next thing the medical sociologists study is the accessibility and quality of healthcare. Okay, I've been telling you from beginning, accessibility or the availability of medical care and the quality of medical care, this is based on the social determinants. There are so many social determinants of health, and accessibility and quality of healthcare is based on these social determinants. Whether you are working, whether you are not working, whether you are rich or poor, whether you live in a country where healthcare is easily available. So many factors. So all these factors are studied by medical sociologists. Okay, so one more important thing is, previously medical sociology or sociology was studied only by medical colleges and medical professionals. Now sociology and social health is a part of the syllabus of every health professional. For example, nurses have a subject called called sociology. There are people studying physiotherapy who have sociology as part of their subject, and all other professionals, pharmacists, occupational therapists, everybody studies social health and sociology, and this is part of their syllabus. Okay, with that we come to the end of medical origin of medical sociology. The next topic is medicine in West and in India. Okay, what is the difference between medicine in the West? West means UK, America and other developed countries. So what is the difference between healthcare system in those countries and the healthcare system in India? Okay, so in Western countries, usually they always consult a doctor or a allopathic doctor who is a medical professional. Okay, but in India, most of the village people, especially in rural areas and even in cities, people prefer to go to non-allopathic doctors or alternative medicine doctors. People who have studied homeopathy, Ayurveda, those professions. So that is the difference between India and Western medicine. But slowly things are changing. In India also, people prefer to go to medical professionals than allopathic or Ayush doctors, as they are called. Ayurveda, Unani, Yoga and homeopathy, these doctors. Okay, they are also professionals, but they deal with disease in a different way. They give different kinds of medicines. They treat in a natural way. But medical professionals, they treat using medicines. Okay, so that is the difference between medicine in West and India. And then we come to something called as integrative medicine. What is integrative medicine? When you mix traditional medicine and Western medicine, it is called as integrative medicine. So for example, there are people who suffer from rheumatoid arthritis. It is an arthritis, means pain and inflammation in the joints. So when a person is affected by rheumatoid arthritis, they go to a orthopedic doctor. Okay, they take medicines from the orthopedic doctor, and they also go to the traditional medicine person. They go to the homeopathy doctor. They take medicines from the homeopathy doctor. They go to Ayurveda. They get some medicines for massaging the area. So this combination of many different types of medicines, homeopathy, Western medicine and Ayurveda, this is called as integrative medicine. Okay, so traditional medicine is a pure form of traditional medicine, either singly Ayurveda, homeopathy, aromatotherapy or massage therapy. These are all traditional medicines. But integrative medicines are when you mix one or more of these health systems together, then it is called as integrative medicine. Okay, and then we come to the next part, which is can alternative medicine used instead of traditional medicine? So it depends on the person's perception. There are some treatments which you have to do, especially for emergency medicines. You have to use the medical professionals and you cannot use Ayurveda. But at the same time, for things like sprain or ligament tear or even other things, you can go for herbal medicine, acupuncture. Okay, what is faith healing? Faith healing means you pray to God and you think you will get a cure. That is called as faith healing. What is folk cures? Folk cures means you go to a traditional healer and you get treatment for your disease. That is called as folk cure. Okay, we come to the next question: is integrative medicine or a mix of different medicines safe? This kind of things has been done for many years. Usually it is safe, especially if you do not take internally. Okay, but sometimes it can also be dangerous. For example, if you have a heart attack and if you go to a traditional healer, then your condition may worsen and you may ultimately die also. Similarly, if you have a fracture and you go to Puttur to put the maavu kattu, what happens is sometimes the condition can get worse also. But that does not mean the medicine or the allopathic doctors are 100% safe. There are risks when you go to the when you go to these allopathic doctors also. Sometimes you get complications. So you cannot say which is safe, but instead we should say we should think twice, and based on the severity and seriousness of the disease, we should decide which medicine that we have to take. Okay, then we'll have to see what is the Indian system of medicine. Okay, Indian healthcare system. We have already talked about Indian healthcare system. The Indian constitution, the government has made rules which has said that healthcare should be accessible for everybody. And the central government makes rules or laws on certain things, and the state government makes rules and laws on certain things. So healthcare is a subject of the state government, okay, rather than the central government. There are certain aspects which the central government make laws, but most of the healthcare is under the state government and is the responsibility of the state government. So each state government feels responsible to improve the nutrition level and also the standard of living of the people, and also improvement of public health. Coronavirus, when it affected the people, it's a public health problem because everybody in the public is affected by this problem. So the government has a responsibility of ensuring that we get good health care, and this health care should be free for people who live below the poverty line, and it should also be subsidized or given at a low cost for those who can afford it but still they are not able to have enough money. Okay, so in India, 18% of outpatient care and 44% of inpatient care is taken care of by the government hospitals or the public health system. So out of 100 people who go to the OPDs, 18 people go to the government OPDs. Out of 100 people who get admitted in the wards, 44 people get admitted in the government hospital. Remaining 56 people get admitted in the private sector. Okay, who goes to the private sector? The people who have money, who can afford treatment in a private hospital, go to the private hospitals. All other people, especially the poor who do not have money, go to the public hospitals. So based on this, the central government has come up with a scheme called Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, or it's in short form it's called ABPMJAY, Pradhan Mantri Jan Arogya Yojana. It is an initiative of the Prime Minister Modi, and it says health coverage, insurance coverage for all the poor people and the lower socio-economic category people in the country. Okay, under this scheme, every family who is affected by health or sickness will be given 5 lakhs per annum, and this will be given to 100 million families in India. and they can take treatment in secondary and tertiary hospitals in the country. So each poor family are given cover of 5 lakh per year, and if they get sick, up to 5 lakhs of treatment cost will be given by the government in any secondary or tertiary hospital. Other than this, the National Rural Health Mission is functioning in our country, and this is as the name indicates, it's a rural health mission. So it is decentralized. The government is not the center of it, but the community is the center of it. And based on the community's needs, they are given importance. For example, health is determined by the availability of water, sanitation, education, nutrition, and gender equality and social equality in the community. Okay, if you have enough water, if you have enough sanitation facilities, if you have education in the community, if you have good nutrition, and if there is equal social and gender equality in the community, then you will have good health. Okay, these are all determinants of good health. So this is the focus area of the National Rural Health Mission. Okay, the last topic for today is differences in medical care in India and the West. Okay, so in India, as I already said, most of the people go to the government hospitals, or 50% go to the government hospitals, 50% go to the private hospitals. But in America and other Western countries, 90% of the people go to the government hospitals, because the government actually supports all their healthcare costs through insurance schemes. Okay, so the Western countries spend a lot of their expense on people's healthcare, whereas Indian government, most of the individuals have to take care of their health costs. And in India, the nature of it, the second point, nature of healthcare in India is mixed. Like government provides primary healthcare, secondary healthcare, and tertiary healthcare. Most of the people prefer to go to private hospitals if they can have enough money to go afford the cost. Whereas in Western countries, all the people, like in USA, they go to the hospitals which are covered by government insurance schemes, and in UK they go to the National Health Service, which is a government health insurance scheme. So that is the difference between nature of healthcare in India and abroad. Then in India, we spend very small percentage of our gross domestic product. That is, we spend a less amount of money on healthcare, whereas in US and other countries they spend a lot more. For example, if the government has 100 rupees income, they spend only 4 rupees on healthcare in India. In US, if the government has an income of 100 rupees, they spend 17 rupees on healthcare. So the countries which spend more on healthcare, they have better health. For example, US ranks 37 in the list of best healthcare countries, whereas India stands at 112. Okay, so if India spends more money on public health care, then we will also go up the ladder. Then out of pocket expenditure for healthcare. What is out of pocket health expenditure? That means how much an individual spends money for their own healthcare. In India, 70% of the Indian population pays for healthcare from their own pocket. Okay, that means we spend a lot of our own money for the health or treatment. Okay, the insurance companies are very less in number and people do not opt for insurance, whereas in US, out of the people spend only 10%. 10% of the people spend money from their pockets. All the others are covered by health insurance. Okay, the next important thing is health insurance coverage. In US, health insurance is compulsory. Every single person should have to have a health insurance. For example, in our country, third party vehicle insurance is compulsory. When you buy a bike or car, you have to pay insurance. Okay, so that even if you have an accident and hit somebody else, the insurance company will pay the affected person. Similarly, health insurance is mandatory in the US. Every single person who earns money has to have health insurance, and the government will pay and the health insurance company will pay when the person gets sick. In India, it is not mandatory, and so people have to spend more money from their own pockets. Okay. And the scope of coverage, how much health insurance covers. In US, health insurance coverage is comprehensive. That means from consultation, from the OPD visit to fever to hospital admission to serious illnesses like cardiac problems, stroke, cancer, everything is covered under health insurance. Okay. In India, it is not like that. You can get specific things for cancer, you can get health insurance for stroke, or you can have a mix of illnesses. So in India there are different schemes, whereas in US the schemes are usually comprehensive or 100% coverage. And based on the insurance companies, India insurance company, the premium charge is very less. Okay. And it is higher in the US. That is because there are the US will cover 100% of your healthcare cost. The insurance companies in US cover 100% of your healthcare cost. That is why the premium is very high. Whereas in India, the premium is very less because there is very few health insurance companies, and the coverage that they give you also is very less. So these are the differences between healthcare scenario in US or the Western countries and healthcare scenario in India. It is mainly related to the health insurance coverage and the health insurance policies, and access to private healthcare or public healthcare. So under these two topics we can divide all these subheadings. Okay, hope you understood this class. Thank you.